you go look at opportunities to kind of get back to that one-to-one relationship with your patient, all our patients predominantly work somewhere, right? And so if you can create that point of service access at their employer or anything along those lines, I think the better. And again, early management is better than delayed management.
Welcome back to Ortho Static, the podcast of the Academy of Orthopedic Physical Therapy. I'm James Spencer. Matt Haberl is with me, and you're catching us midstream on a whole bunch of episodes about our experiences in business ownership in physical therapy. I own Ajax Physical Therapy. We're home-based physical therapists, mostly out of insurance, based in Aspen, Colorado. And Matt is in La Crosse, Wisconsin, and owns Dynamic Performance and Therapy. I think a nice disclaimer at the front is we're not experts in any of this. We're just sharing our experiences and chatting about this. We'd love for you to add to the conversation wherever you can on Facebook, Instagram, over on our YouTube channel, and anywhere else. And without further ado, let's get into this episode. Today, we are talking about building community in physical therapy, things that we can do as physical therapists that get us out and serve our community, but also they kind of work as marketing products too. And if it's okay, Matt, I'm just going to jump in with our big topic around here in Aspen, which is ski injury prevention. We talked about this a little bit in one of the past episodes, which I of course think you should go listen to. And it's just kind of our niche. Our practice is it's myself and my wife. We're the only employees of the practice, but we just love skiing. It's why we live out here in Colorado. We came from the Northeast. It's been our passion all along, and I've always wanted to work. I mean, everybody we work with is a skier of some level, and a lot of them are pretty darn good. And a lot of our patients have been injured while skiing. So we're already working in it and talking about it all the time, but I always have that craving to get a little bit closer to skiing. And in our practice, we've started doing a lot of presentations to the local ski company, which employs thousands of people in a very small community. They are by far our largest employer. And we go and we talk about ski injury prevention and the things people can be doing to keep themselves on the slopes all year and keep themselves working and keep themselves skiing. And the message has really, I think it's been received very positively. And for us, that's just been finding that passion and getting it into the community. And I would say so far, it has not necessarily translated into a whole bunch of people knocking at our doors, clamoring for physical therapy for their ski injuries. But the message is, it's starting to grow. And I think, I'd say there's a certain sect of people who, when they think of avoiding surgery and when they think of avoiding ski injury, they do think of us. And so I think it's working and it's growing. Matt, is there a topic like that you guys work in there?
Yeah, I would agree. And that was going to be my first thing to say to you is like, be patient because, I think right now you're establishing you are the expert in that area, right? When it comes to someone's medical needs who are skiers, you're going to become that expert, right? And right now the name is just getting out, the patients are slowly trickling in. All of a sudden, there's going to be a backup because you are now known as the expert in your area. And I think that's something we've done in our area. We've, again, tried to establish therapists who have, we're a large part of the CrossFit community. One of our, former episodes was with Jake, who was a former CrossFit gym owner and coach, and so he's built that community. We've got the running community. We're in La Crosse, Wisconsin, where there's a ton of trail running, mountain biking, and so being ingrained in those communities. And I know one of our other therapists did something about community engagement where he's also the president of the running club, so being ingrained in those areas within your community. And, we've even encouraged it to even so I'm at a different age of life where my kids are involved in sports. Another therapist, same thing. So she's now the soccer coach of her, of her small soccer team. And so now she's using those, we're using those avenues. After this talk, our girls are involved in gymnastics. I'm going to meet with the personal trainer that does the training with the, with the gym. And then I also have a relationship with the coaches. Right. And so creating those relationships, help help the community recognize who are the experts in these areas. And I would say for us, that's what happens is like even though we're predominantly self pay, and uh, most of our patients have gone through kind of the healthcare system, and you know probably why I left the healthcare system. You walk out to the edge of the cliff and they just kind of say, "Oh, you're done," kick you off. But when it comes to a sport like CrossFit, gymnastics, some of those high level activities, that edge of the cliff comes way too quick, right? And so, skiing is going to be the exact same thing. How many are going to get discharged from formal PT in the healthcare system, but aren't really ready to go back to skiing yet? And so those are the people that then kind of were identified then as the experts. And we've even dabbled into this is something I was going to even ask if you've done yet, is actually offered classes in terms of not just like educational, but like here's your performance training class, right? Or what style of coaching can you do? Can you do some virtual coaching or some hybrid, developing programming for people so that as they go into their ski season, they're physically fit and ready? Things like that, like the other avenues you can kind of really develop in creating that community presence, anywhere from injury all the way back to performance, and I think that'd be something. I think there's probably plenty of avenues you could probably even look at even with the skiing side of things. So
Yeah, they, as far as the question of have we done any courses around here or anything like that? I mean, for the ski company, we have done presentations to all their employees, really, which has been a great thing. It's been enjoyable for us. We've gotten a few patients out of it, and I think the people who've listened to the presentations have really benefited from it. And it's something we want to keep doing and keep pushing on it and keep getting as involved as we can. With the ski company, um, which goes into a little bit of a piece of this talk that we're kind of skirting around, because Matt and I were talking before this presentation about occupational health, about working in the workplace and working with healthy workers and injured workers, and really the theme of physical therapists getting into these employee sponsored programs where employees really have an incentive to decrease their overall healthcare costs, and physical therapists are well situated to lower those healthcare costs. I mean, this is a big thing that physical therapists are doing these days, and it sounds like Matt and I are both kind of like skirting around that world, but we haven't dived full on into it. And I know the Academy's occupational health SIG has some great resources on it, independent study courses that you can buy and learn about the clinical practice of it. And they've also partnered over with APTA Private Practice, who has courses about the business side of it and how you develop those relationships and how you get into it. So I mean, I think that's a really exciting area, and it's kind of something I'm dabbling in and talking with the skiing company and ski injuries and all of that, but haven't gone full into. And it's an area I'm always looking at, and I'd like to expand in.
no, I agree. Like I said, it's one of those I know just enough to know that it'd be beneficial, but not enough to fully integrate it yet, right? And that's again when you go look at opportunities to kind of get back to that one-to-one relationship with your patient. All our patients predominantly work somewhere, right? And so if you can create that point of service access at their employer or anything along those lines, I think the better. And again, early management is better than delayed management. So I
Yeah.
think all the evidence points us in that direction. We got to stop skirting around on the edges, right?
Yeah. I've actually been trying to get a group of physical therapists together to do a community talk here. Um, we're all like willing and wanting to do it and but we're not really available to do it. It's kind of one of those things where we're like, yeah, let's talk about physical therapy to enhance the message of physical therapists, but we're all too busy in our own practices to go do it. um, but it's really those topics of injury prevention, of avoiding surgery that you don't need, and imaging that you don't need, and injections that you don't need, and really the hard message of, hey, you've sprained your ankle, hey, you've tweaked your back, hey, you have had some sort of musculoskeletal injury, you should think of your physical therapist first. And it's something that a few practices in town that we're all talking about and trying to get together to do, but we just haven't been able to execute it yet. And I think something like that could be so powerful for our community to elevate, not just my practice, but the whole physical therapy profession in this community to get people thinking about us when they have an injury of any kind.
Yeah, that brand of PT, right? So, what does the brand of PT offer? And I think that's exactly what we do. So,
Yeah. How you know, this has been a topic over many years, which people have a lot of different opinions on. What do you think of the brand of PT in your area? What do you when people say physical therapy or physical therapist, is that something that's coveted?
yeah, I think it's shifting. I think it depends on where you go. Like depends on who you talk to, right? And I think it all comes back to that's what's that previous experience. I feel like in our area, it's definitely been shifting to a more positive. It used to be what you got after you had surgery. It's not something you got before surgery or prevented surgery. Whereas I would say it's definitely shifted in that realm. Um, Whereas I still like look at my parents back in Northwest Iowa. I would say the brand of PT, is still kind of pain and torture, and it may or may not help. They don't want. I think that always is going to be a work in progress. In terms of I think as our profession continues to push forward, I think creating more direct access, creating more patient care outcomes, and getting more of those positive messages out there. The only the stronger the brand will get. I'd say chiropractors still probably have a stronger brand than we do. Like
Mhm.
you hear the word chiropractor and everybody knows exactly what they are and what they do. Not everybody still knows what a physical therapist do. If they do, they think it's pain and torture, and that's not a positive brand yet. We need to get that changed. So
Mhm. I think the thing. I mean, this is just my personal passion, but I think the thing we've got to hang our hat on is we are your evidence based rehab provider. Unlike anybody else, we have more science and educational background than anybody else in this realm, and we're really good at helping you avoid surgery. And there are a lot of paths you can be on that end in surgery, and physical therapy is your best chance at avoiding that. To me, that's the place we got to do better at.
yeah, and the way I kind of present to people, we're the ones who bridge the gap between health and wellness and medicine. And so, depending on which side of the field you come in on, if you're on the medical side, we can get you back into the health and wellness realm. If you're on the health and wellness realm, we can keep improving you to performance. Like we're not limited to a single technique. So a lot of people will ask, do I need to see a chiropractor? Do I need to see a massage therapist? Say, well, here are the things I do. I do manipulation. So if we feel like that's indicated, we can do that. I do soft tissue work. We can do that. Right. So getting people to understand that we're more than just a technique, and as long as we're on a common goal with them, with getting them back to whatever it is they love and what they want to do, those are the best ways we can change that field. And, evidence is going to be one part of the story, but the patient's expectations are going to be another. And our expertise is going to be the final leg of that. And so like putting those three together, right, and letting the patient kind of be the center column of all that, holding it together, I think is how we change that. So
Sounds like you're talking about evidence based healthcare with a community focus, Matt. I like it.
yes.
And with that, I think we've reached the end of this episode. We'll talk to you real soon, and we thank you for listening. And again, subscribe, like, and interact on all our different social media channels.